I'm Kelsey. Today we're at DermaFX and I'm going to do some beautiful facial markings on Amber for Neuro, some on-label and off-label options. So on-label, traditional areas would be glabella, frontalis, and crow's. So let me see you frown. So I like to do a 5-point mark, one in the belly, frown again, and then 2, 3, 4, 5. That's like traditional marking. She doesn't have much moving, but obviously if someone had more movement, you would do the markings based off of that person as well. So the frontalis muscles kind of goes like that. Some people also pull in the center. I always add a little bit in the center just because if I'm just doing both sides, they'll start to pull in weird areas. Raise your eyebrows. So you go 1, and this also depends on how many units. So there's something called a no-go zone for Neuro. If you lifted, some people get this crease down here. That's very, very close to the no-go zone. This area, basically, is a no-go. You'll drop your patient real fast, okay? Okay, so now smile. I like to do a lateral brow lift. So very superficial placement for these and very, very minimal. So if it's Botox, it's like 1 unit, 1 unit, 1 unit, and then that here. Depending on movement, obviously this changes. So this is very by patient basis, especially for crow's feet. But crow's feet are very by patient, especially if you have a more advanced age patient. You have to be careful of how low you're going in this area because you can drop them, you can give them ptosis. You also have to be careful that you're not getting too close under the eye. Some people, if they have fine lines when they smile, I'll do little superficial, very, very superficial points and scatter it like baby Botox kind of to soften the wrinkle but not knock out the muscle so they don't get like a funky little smile.